So I wanted to tell you guys a bit about my work and life in Tanzania and what I've been doing here and how I see it as really trying to work on the advocacy role. I started here about 10 years ago when Dr. Yates and I and our husbands came to Tanzania with a group called Canada Africa Community Health Alliance. We came for a 2-week volunteer, what they called medical caravan. And so we just came and worked and saw patients, and it was a really wonderful experience. We kind of fell in love with the place and the people. I did a lot of thinking at the time and afterwards, though, about the social determinants and how much they were affecting the people of the region, of the Kilimanjaro region, and in particular women. And so gender and how that really caused inequities in health and through pretty much all of the social determinants. So when we met a woman called Mama Minde, or Elizabeth Minde, who is a human rights lawyer, and she was actually the first female lawyer in East Africa, we were talking to her about how we could help the people of the region, and in particular the women of the region. And she said, please start a shelter. The reason she said that is that she has a human rights organization. She's been working for 25 years helping women with their legal problems. But she, on a regular basis, will have people come to her office, and she'll do everything she can for them on a legal from a legal perspective, then sends them out onto the street with their children and one bag with nowhere to stay. And so she really felt that a shelter would help. She talks a lot about customary law versus constitutional law, which is kind of interesting, and it was an eye-opener for me. Customary law is if you get married under customary law in the village, then that's how you follow those laws. And those involve things like if your husband dies, you're kicked off the land and you no longer have the house. Or sometimes even, she said, on a regular basis, the way that someone can actually stay in their house is by marrying the husband's brother and that kind of thing. So Mama Mende has told us many, many horrific stories which really hit home the fact that there are huge inequities for women. So we started the shelter, and it was a shelter and also a support system for women to empower women, and in particular empower women with HIV. And so we had support groups and education sessions and the shelter. And then we also had a clinical officer come on board to see patients. The clinical officers are the backbone of the medical system here. But very quickly, more and more and more people were coming for medical care. And then another shelter was started in town, and so the shelter aspect of our center wasn't as important. So when we moved to this building, thanks to a donor in Canada of Tanzanian descent, we were able to buy this building instead of renting. We decided not to have a shelter anymore and really focus on the medical care. We also have focused on the social determinants through other things like business training programs and microfinance to help women become self-sufficient, and so that they have the liberty and freedom with money to be able to take care of themselves, take care of their children, and hopefully educate their kids, because education is a really big determinant here. If people don't have money and their families don't have money for them to go to school, they don't get an education, and therefore the cycle continues, and then they're not able to get good employment in the future, and they're not able to support their kids. So as far as advocacy, we really base this center off the idea of our motto is one woman at a time. If you can change the life of one person through advocating for them in whatever way they need, be it healthcare, be it getting a health test that they weren't able to get, any way that you can to change the life of that person, you'll change the life of their family and their community, and the effect grows. And I would say if I was going to put my role as an advocate into a nutshell, that would be it. Every day, although we see hundreds of people, I'm looking for that one person that we're actually changing their life. And on a regular basis, we do have those people and help those people, and it's really, really fulfilling. So I'm going to stop talking now because I've had the absolute joy of having 4 clerks from Queens here doing an elective with me, and I think you'll get more out of hearing from them and little tidbits about what they've learned about advocacy on the global level. So I'm going to hand it over to them.
Mambo. This is Hai from Tanzania. My name is Chintan. I'm a fourth year Queens medical student, currently on elective here with Dr. Carpenter. There are many opportunities for advocacy that I've seen here, particularly at the patient level. There was a patient that we noted today at the caravan. He was a 65-year-old gentleman who presented with complications of a recent stroke that he suffered, had persistent left-sided facial paralysis and right-sided weakness in his arms and legs. And the decision, I guess, was what should we do with him? Back home, we wouldn't think even twice to send him to a CT scan, link him up with a neurologist, have OTPT involved, and get him to complete care to help him deal with his complications from stroke. But here, in a global health perspective, advocacy comes in many ways. We need to be cognizant that advocacy doesn't particularly mean, going out and calling their specialists or sending them to the emergency immediately for emergent surgery. That does entail it, but specifically for global health, it also includes understanding the living standards and the situation of the patient, and understanding what their needs are, and giving them treatment and follow up accordingly so that they can actually successfully finish that and still have good health outcomes. So for this gentleman, for example, we couldn't order a CT scan because here a CT scan would cost him 300,000 shillings, or roughly about $150 out of his pocket. Given his social situation, we determined that having managed his risk factors, including hypertension and arrhythmia with medications, and having him follow up with us would be the next best step, as well as getting him to get some physiotherapy, which would all be low-cost interventions, but would still prevent future strokes and would help him on the path of recovery. So my message would be in global health, there are multiple ways for advocacy, and sometimes it's not as straightforward, and understanding the patient's situation and advocating appropriately will still lead to best care in a global health setting. Thanks.
Hey, I'm Trevor. I'm one of the fourth year medical students here with Dr. Carpenter. Before coming to Africa, we really didn't have an idea as to how we could best advocate for people here. Some opportunities that we've noticed while we've been here would be to have a point of care ultrasound machine. Today I saw a person with a possible abdominal aortic aneurysm, and it would be nice to be able to tell right here at this clinic, which is actually a school, whether or not he has a life-threatening condition that we need to send him immediately to hospital for, or we could watch and wait. We also don't necessarily we bring as many medications as we can on the bus, but sometimes we run out. So if you are trying to prescribe a certain antibiotic eye drop and we run out of them, then you get the next best thing that we have available in our box. So just things that maybe we don't think about at home because we've kind of got unlimited supply of medications everywhere. But we always get taught to do the evidence-based approach, and sometimes that's just not possible. So some things that we can do to advocate for people here. So those are things that we think about when we go home as to what we can bring back to the community after we've left.
Hi folks, my name is Alex Chase. I'm one of the members of the class of 2017 who's here in Tanzania working with Dr. Carpenter. One of the things that I've really learned about advocacy during my time here is the importance of building interventions from the ground up with the involvement of local community members and organizations such that we can create a positive space for sustainable change to occur. One of the organizations that we've been working with that does this is called NAFGAN, and they're an NGO dedicated to eliminating female genital mutilation child marriages and other human rights violations against women and children. And they do this primarily through education of the community and of the children, and through providing a shelter for children, especially females, to come and stay at. Another organization that we worked with is the Women's Dairy Co-op, and they're able to empower women financially because the dairy industry here is not as regulated as some of the other industries, and this is very important for us because those regulated industries require the man's name to be on all the paperwork that they hand in, which makes it very difficult for the women to receive any of the money for their labor. So with the dairy co-op, women are able to work and get the money given directly to them, which they can then keep to empower themselves through paying for education, paying for their own access to health care, and all sorts of other necessities. There are a number of other organizations that we work with that we won't get into now, but I really just wanted to sort of underscore the importance of being involved with the local community.
Hey, my name's Jonathan. I'm in the class of 2017, and I'm in Tanzania right now. And a big part of advocacy for me that I see in this area is, and especially for advocating for local women, is through health education. Last week we were fortunate to go to a village and go to a local factory called African Vegetables, which employs mostly local women. And we did a day of education. We talked about UTIs, STIs, cervical cancer screening. We talked about contraception and family planning, and it's important that through health education we help women understand that they should seek medical treatment. They have the right to seek treatment. They have the right to family planning access, and by helping inform them and answering many of their questions, they had questions like, do contraceptives cause cancer? So there's a big education barrier, and by hopefully empowering them with this knowledge, they can seek treatment, seek care, and take better care of themselves. Yeah.
So from what you guys just heard, I wanted to highlight just a few of the key points from my perspective with respect to advocating at the global level. The first would be to address the social determinants of health whenever possible. The next one would be to work within the existing system to advocate for every single patient on an individual basis based on the means available. And that doesn't always mean the epitome of evidence-based medicine. Sometimes you need to make different and creative but still appropriate decisions with the patient based on the resources that the patient has and that the healthcare system have. The next would be to always be aware of the link between education, poverty, gender, and health, and to try and mitigate the effects, the negative effects whenever possible. Also remember that health education and social supports are a great way to help empower people to look after their own health and that of their families. And then finally, remember to partner with like-minded organizations as well as the local medical system to create a force to support health of the people. So I hope you enjoyed hearing from us, and I look forward to lots of discussions with you guys in the future.